GM, everyone. GM. Very big welcome to our live session today. A few quick housekeepers, pointers before I invite our amazing guests up to join me. If you've never been to the Hub before, on the right of your screen, you'll see a whole section where you can drop us chat or you can ask us a question. There is a Q&A section, but if you just drop your question wherever you want, Matt will pick it up and put it in the questions for us. And you will see that there is a handout section where if you want to pick up our guests' contact details, you can go there and pick them up. And later on, we're going to have a poll, which will pop up onto your screen. When the polls pop up, just remember, it just pops up. You have opportunity to therefore vote on it, and then it will disappear. So it'll literally take a couple of seconds, not even a second. So that's that. Also, what you will notice is down below, yes, down below, we have some emojis. The emojis, and thank you, Matt, we have a particular one today, which I'm very pleased to have. We have our own health emoji. So we are here to talk about health, and we have a health emoji. We definitely need a few of those. So if you hear myself or our guests talk and there's something that you really love, please do put that there. That will be really good. And so finally, if there is anything that you hear us talk about and you think, I'd really like to know more about that, or you'd like us to cover a different topic, when you're on the Hub, you can just go down to the bottom and fill out our feedback form. And if you do that, we'll get that, and then we'll be able to pick up the ideas that you're sharing. And then finally, how we're going to run the next 45 minutes. There is myself and two guests. Because there's three of us, it's going to be a bit of a conversation, some questions, and we're going to bring you some examples of what we believe are evolving practice ideas, combining Web3 technologies and the health services across the globe. So that's what's going to happen. That's how you use our room. So what I'm also going to do is I'm going to start by sharing the screen just for a couple of moments. So here we go. I am going to share the screen, bring that up, and hopefully that will come up. I'm just waiting for it. There we go. Just had to click on a certain button. So you have my screen in front of you. So Web3 in health, and all the benefits we want to talk about, and even the issues like costs. So we're just going to touch on lots of different issues today. So that's where we're going to start. But the first thing is we have a little poll for you. So if Matt would please happily put up our first poll. The first one is, how many healthcare professionals are there across the globe? So there we go. Have a little guess, and then that will disappear. So, and then the second one is 8.3 trillion US dollars. What do you think that figure represents? There we go. So hopefully everyone's had an opportunity to do that, and no going back and checking with ChatGPT. Answers are logged already. So cracking on from that, I want to take a moment to invite our first guest. And I'm going to invite Sharonda up first, because Sharonda I've known for the longest time. So welcome to the Hub, Sharonda.
Thank you. I'm so happy to be here. This is my first time. I'm so excited. Thanks so much for having me.
This is brilliant. So welcome, a massive, great welcome. And we're getting to who you are, what you do, what you've done in a moment. But before that, I just want to take this moment to invite Christopher up onto the stage. Christopher and I met from a in real life event where Sharonda and I met virtually. Christopher and I were both at an event that was taking place in London, and it had finance and tech people. And it seemed that people said, oh, you two are both in education, so you should connect. So welcome, Christopher.
Yeah, my pleasure, Alison. Thanks for having me here, and I'm looking forward to the discussion.
I failed to press the button. Sorry, I failed to press the buttons already. First thing gone wrong. So there we go. So Sharonda and Christopher, really massive welcome onto the Hub. And then for myself, just for those who, if anyone hasn't met me, I'm Alison Alexander. As I've said, you will see all of our Twitter handles if you want to connect with us, but also if you jump over to the, if you look above the chat, we've also put both Sharonda's and Christopher's contact details. So please do take a moment, note them down. If you click on it, it will open in a new window, so you won't lose us, which is great stuff. So Web3 and healthcare. So I'm going to stop sharing to start with so that we can get us all up on the stage, which will be really great. Stop sharing. There we go. Hitting the right buttons, get in there tech-wise today. So that is really good. So I really want to kick us off by inviting you both to kind of tell us a bit about who you are. So it would be really great for the audience to know, obviously they know your name and your Twitter handle, but please feel free to say more about that, but more about how many years have you been connected with healthcare and what's your current role in healthcare? And I wonder if I can put Sharonda, you on the spot first to start, and then straight after Christopher can just jump in.
Sure, of course. I'm Sharonda, as you've already stated. I'm a registered nurse here in the United States. I've been a registered nurse since 2005, where I got my nursing degree at Miami-Dade College, and then I went on to do my bachelor's in nursing at Grand Canyon University. So I've been in nursing now, what is that, a total of, oh my goodness, it went by so fast, 18 years. Wow, almost 20 years. Most of my career has been in perioperative services where I work in the recovery room when you come out of surgery. However, after COVID, I became a travel nurse, and PACU is not always available as a travel nurse. So I do some ICU and some step down nursing right now. Because I'm building and a founder now, I only work about 2 or 3 nights a week, which is down from 6 or 7, which I used to work before. So I'm really excited about the possibility of Web3 giving me some reprieve from nursing. So thank you so much for having me here today.
Oh, excellent, excellent. Well, yeah, I'd like to just say a bit about myself. Like Alice said, yeah, Christopher Mensa, based in London, UK. And my initial experience with healthcare is my mum used to work as a nurse, working nights for about 40 years in the private healthcare sector, like Princess Grace, Harley Street, Portland's, all those type of hospitals. So she was working there. She thoroughly enjoyed it, and that sparked my interest in healthcare from as a son of a nurse. And recently, only recently, that I got involved in a hackathon, a health technology, health tech hackathon in the Middle East, and I'll talk a bit more about that coming up. But that really piqued my interest to see how I can create some solutions within the healthcare industry with Web3. And I'm very excited about the possibilities. And I think healthcare is built for Web3 to innovate. So that's it.
I'm sorry, I was speaking and then realizing I was still on mute. I totally agree with you on that one, Christopher, that healthcare is, I mean, I want to say ripe for absolutely building on everything in the Web3 world. So that does bring us really nicely into our kind of the next kind of question in terms of, so we've heard about both of your histories in health. And I think one of the things that I wanted to say is to add to that, when we first met and we all talked, that commonality you had was around your experience of nursing, Sharonda being a nurse and your mum being in the nurse as a nurse. And not just that, but actually how they did their nursing careers, that they did nights. And I think that's a really important point that, I mean, Sharonda, you said 5 or 6 nights. I mean, 5 or 6 nights. And I know Christopher said his mum worked every night. That's, I mean, doing that to be able to raise children, like take care of yourself and others. I mean, it's a phenomenal thing. And as you said, once we all experienced COVID, the impact that had on nurses as well, absolutely phenomenal. So firstly, major emojis to you both, or to Christopher's mum and to yourself for everything that you have done for all of us. Yeah, massive thank you.
Yeah. Thank you. It's well received. Thank you.
So and I feel really privileged that, like, often you hear some of these, and I am going to say webinars, where they talk to people about healthcare and how you could change it, and they're often from an academic perspective, and this is brilliant. Yeah, like, real people living, breathing, working in the healthcare industry. Really important. So from that, I am going to jump straight into Web3. Yeah. Now, just to do remind you that some people who listen are absolute newbies to Web3. And there are those who might listen who love Web3 and just want to explore a new area. And so just be mindful of that when we talk. So we've already said Web3. Obviously, people have come into our hub and explored what that is, but that being that real umbrella term for everything that we're going to talk about, all of those techie tools, all of the most important thing for me is not just the tech tools, but the cultural revolution that's kind of taking place with Web3. And so we'll hear more about that as we go on. But if you do think that you use an acronym, please do take a moment and just share with the audience what that means. Okay.
Absolutely.
So in terms of what brought you to Web3, we started with Sharonda last time. So Christopher, I wonder if we could start with you. What brought you and what was your first encounter with Web3 and what made you stick around? I know you've said a little bit about that, but if you could unpick that a bit more.
Yeah, absolutely. Thank you, Alison. I mean, my background is technology. I've worked in the technology industry, IT technology, for over 20 years, and 12 years of that was at the London Stock Exchange in the City of London. And as a group, the London Stock Exchange group, they wanted to explore emerging technology, and blockchain technology was one of those technologies they wanted to maybe introduce to the group. This is going back to about 2015, 2016, in the earlier days, and then the whole technology and disruptive nature of it really enthused me in a big way. I was so enthusiastic. I learned as much as I could, and the technology was very wasn't mature enough because there was Ethereum, Bitcoin, and Litecoin, and different. Ethereum was just getting started actually at the time. So I wanted to know how I can participate. Being a technologist, you're always looking at the deep, get into the weeds and everything like that. But I think I had to think a bit higher level and thinking, how can this impact people? How can this impact commerce, as well as the broader landscape of the internet? Because we are talking about another layer to the internet, and the intended purpose of the internet is going to be realized with Web3, and that's really where I see things are going. And Web3, obviously, is a third iteration of the internet. That's what Web3 stands for.
Yep.
But I think it's very much a case of really exploring the social, financial impact of Web3. And also, and a very, very important part, to bridge the gap between the people who have been not say marginalized, but not included. It's going to be more inclusive for individuals across the world to be able to participate in a way that they've never had the opportunity to do so since the internet began.
Honestly, so much of that vibes with how I first came in, but we won't do that now. So I am going to jump over to Sharonda and ask her, okay, Sharonda, so what brought you to Web3 and what was your first encounter? And again, the same, what's made you stick around?
Yeah, so likewise, like Christopher, the possibilities are why I'm still here. Why I came, what initially brought me to Web3 was my youngest son is an artist, and about 17 months ago now, I noticed him doing digital art. He mentioned something about NFTs. We started researching NFTs, and I think within a weekend, I fell down the Web3 rabbit hole. And I mean, I just was like, almost, and I don't take this for granted. Almost immediately, I had like a download of all the possibilities that this new technology could bring to healthcare and to the world, and just closing wealth gaps and all those things. It's like I stood in my garage and it was like a UFO just came in my brain with all of the possibilities that could happen. And honestly, it hasn't stopped. So that's what has kept me around, is that every day I can think of a new way that this technology can improve the world. But shortly after falling down that rabbit hole, I joined a community here in Miami called Web3 Equity. And it's an education community, an onboarding community for women led by the great Michelle Abbs, very well known here in Miami. Upon joining them, I received a scholarship to the Every Realm Academy. And as a result of that, I was able to learn everything about NFTs, blockchain, crypto. And so since then, I've just been sold. I try to take as many classes as I can with the time that I have, and just try to continue learning as much as I can so that I can really be a bridge between this technology and my family and my friends and everyone that I'm around. So that's kind of what brought me here, and that's why I'm still here.
That's amazing. And firstly, we have had Michelle and I have had a chat live on our Hub.
I saw that.
And that was really brilliant. And secondly, and I didn't say this at the beginning, but it was actually Sharonda who literally I say Tussle Tribe, because I often refer to it as that Web3 equity. And they did something on LinkedIn and they were having an event. And I wrote to Sharonda to say, can I go to this event? And we'd never met before. And so literally it was through her who then responded, who then got me connected in, even though I was virtually. And that led to that whole bit of me buying my first mint, my first NFTs, everything. So that was amazing. So thank you for that.
No, thank you for your continued support since that day. Like, I had no idea we would still be here now doing this. So I'm very grateful.
It's brilliant. But what I think is, and for me, I do just want to share, the reason I came into Web3 is I was working in a virtual reality company, and we were producing virtual reality films to help people have greater empathy. And I truly believe that is a way to help people, and it's the same as getting people into the metaverse, and we can talk about that in relation to health. But literally I was walking down the road reading an article on my phone, as I often do without falling over, and it was all about helping people go bankless. And Pera Perez, the founder that I work with, he was the one who sent it to me and was like, have a little look, have a read of this, Alison. And he read it, and I had that bit of you said in your garage where the aha moment of walking down and going, oh my God, this is phenomenal. This is going to change the economics of the world. We are going to turn the world upside down by absolutely this new technology. And for me, that is what brought me in. And it's just from then on, because I've got a long career in public services, every day I just see, oh my God, we could do it like this. Oh my God, we could give more people the vote by doing DAOs, which is a really important point, because it brings me to my next question around DAOs. So a decentralized autonomous organization, some might see it similar a bit in the non-Web3 world, a bit like cooperatives, if I just try to put a slant on it. But we're jumping to that in the health world. Why are we doing that? Well, because Sharonda is responsible for founding the Huddle DAO. I often call it the Nurse DAO, but actually it's the Huddle DAO now. So over to you, Sharonda. Tell us what it is and why you've set it up. And I'm going to bring a slide up just to show everyone an image of it while you're talking. I won't be disrupted, I promise.
Thank you so much. Thank you for introducing the topic of DAOs, or decentralized autonomous organization. The Huddle DAO or Nurse DAO, whichever way, we're the only DAO right now that has been founded for the sole purpose of empowering nurses. So we're by nurses for nurses. And basically the goal with any decentralized autonomous organization is to have an organization that everyone has a voice in. And the way that this voice is managed is by the blockchain. So in a decentralized autonomous organization, there's a group of people that come together around any central idea. The cool thing about a DAO is that you don't need a physical place. You don't even need a virtual place to meet. DAOs are built of people that all are on an equal level. So in a DAO, everyone can contribute their ideas. In our DAO particularly, we vote based on our reputation. So depending on how long you've been in the DAO, your vote weighs as much as your reputation weighs. We put proposals together. Anyone in the DAO can put forth a proposal, and then we vote on that proposal. And all of this is guided by the blockchain. So a decentralized, autonomous organization is decentralized because there's no central governing body. It's autonomous because it's run by the blockchain. And then it's an organization because it's a group of people brought together by the same mission. Our mission at the Huddle DAO is to empower nurses to use Web3 technology to change the future of healthcare. So right now we're getting ready to launch an NFT to put appreciation for nurses on the blockchain. But in the future, we hope to bring together a bunch of different nurses with many different backgrounds that will create a whole new way of delivering healthcare to the world.
Wow, wow, wow. What do you think of that?
That was it.
I'm like,
that was my speech. Huddle down.
Yeah, that's wonderful. That's absolutely stupendous. I think we need this, and yeah, I mean, in the UK, you can really tap into the UK market as well for this, and that'd be interesting to see how a lot of nurses in the UK can really accept this way of getting their voice out there, because instead of just striking, and unfortunately they have to get any recognition in appreciation and pay, this could be a great way for them to participate.
And this is the bit where I was thinking around, even in local government, you could use DAOs to really infuse communities to vote. And it's exactly the same, isn't it? You can actually give everybody that voice, and actually it becomes really clear what people are thinking and feeling about it. And people can also then feel really valued. I think it's amazing. But I think when I first heard of it, I was like, how is a DAO going to help nurses? Go for it, Sharonda.
I think I'm shorting because I'm hearing like every other word. But one thing that I want to say about Huddle DAO and about DAOs in general is that with nurses right now, when we do strike, whenever we organize against an institution, is normally via a union. Unions have presidents, and oftentimes those presidents have their own goals, their own initiatives, their own campaigns that they're running. And so the whole union ends up supporting that person's ideas. The goal with the DAO is for everyone, the bedside nurse, the CEO nurse, the research nurse, for all of these nurses to be able to come to the table and say, this is what the future of nursing looks like. I was so touched, and I am so touched by Chris's story of his mother that was a nurse by 40 years. Every time he mentions it, I get a little bit teary, because as nurses, we have two choices for shifts: 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. You don't have really that many other choices. So you're going to miss either the whole day with your family or the whole night. A group of nurses that all have a say can say, no, 4-hour shifts might be better, or I may be willing to work 8-hour shifts, or maybe I'll work Saturday and Sunday and be off every day of the week. So I think the decentralized component gives every nurse, despite whatever their background or experience is, the opportunity to have a voice in what the future will look like, because nurses are leaving now in droves. And if we don't do something, I don't know if there'll be any nurses left to take care of even me.
It's that real issue about the nursing working in ways that suit the institution to enable them to run the system, as opposed to it being done to suit the individuals who are working there. So I think she's shorting a bit. So on that, I'm just going to jump over, because I do want to jump into, Sharonda ran a hackathon, and I think I really would like to hear about that. But I also know, Christopher, that you participated in a hackathon. You told us at the beginning. So I wonder, whilst we hopefully get more airways through to Sharonda in between, that you can tell us a bit more about, well, what the heck is a hackathon, firstly? And then what was the health hackathon you went on? And what were some of the outcomes? And then from there, I'm going to invite Sharonda to come back and tell us about her hackathon and the outcomes that brought. So I'm going to stop sharing and then bring us all back up.
Yeah, absolutely. Yeah, I mean, hackathons are, to my mind, were initially synonymous to technology. So we have maybe a week or 3 days of intense event where different teams or groups of individuals come together to create and build a solution to a particular ask by the hackathon. Okay, so when I was asked by a contact in who's based in Saudi Arabia that they're running, the Saudi government are running a very interesting campaign or vision for 2030 to transform the whole nation into a very vibrant community and nation. And one of them is to create innovation. So the hackathon I went to, it was based around health tech, but it's more from the ideation phase. So the initial phase of having an idea and then going through a process of how to present that idea to potential investors. Okay. So they had regional rounds of people to create a final hackathon of 23 teams from across the country. So they came to a place called Daman, and this was run by the Ministry of initially in association with Ministry of Health as well as the Ministry of Defense. Okay, so it was a big hoorah, big event. And I was there as a mentor to initially talk about blockchain in healthcare. I did a presentation, slide pack, and I showed them exactly what the challenges are and how blockchain can help with that. But at the same time, I helped every team go through the process of go for their value proposition, their slides, their finances. How would you present your idea in the best way to a VC? And then at the end of it, there was prize money to be had, a nice amount of prize money that was put up by the ministry, and that's what I'll go for. That was one hackathon. Then I went to another city, Riyadh, to do another one, but mainly working with cardiologists and technology solutions for cardiovascular challenges that they've got. So it was a mixed bag of the first one, but this one's mainly focused on cardiology, and I helped with their ideation and presenting of that as well in hackathon in a very short time frame, 3 days. Yeah.
Wow. So Sharonda, have you got your signal? Is that coming through clear now? Yes. Perfect.
No, and it may be on my end. I'm hearing every other word though, so I can piece it together.
Okay. Well, we can hear you really well.
Yeah.
We can hear you. So can you tell us about your hackathon?
Yeah. So
and what were the outcomes?
it's definitely me. It's me.
So
yes,
hackathon.
gladly. Christopher, that sounds like such an exciting event. Our hackathon was on a much smaller scale, but I still am very proud of it. It was a hackathon that we had called the Huddle Hack, and it brought college students, nursing college students, together with with college level computer engineering students. What they did was they hacked around different ways to apply Web3 to healthcare. The two teams created two wonderful ideas. One team, the winning team, created a nursing literacy platform that basically helped nurses via AI deliver the right patient education to the patient. So that was an excellent idea from the winning team. The other team also had an excellent idea. Alison was one of our judges, so she can tell you how difficult it was to choose a winner. But the other team had an idea around virtual reality and preventing falls. So it was so exciting. I myself participated in my very first hackathon. And that's how I got into innovation as a whole, because it was so exhilarating to actually have an idea, put it down on paper, and then actually think of how it could affect the world. So I'm very excited about the possibility of hackathons, and I really believe in the concepts and ideas that come out of hackathons.
And I find them really empowering, because, as you said, you can take a collection of people, and actually your status in a company, your previous experience, actually what you're there to do is to work together on this one issue. And actually you all have the same amount of influence in that room. And I think it really is a way that it's kind of that listening and empowering everybody, isn't it? And it gives everybody that opportunity.
Yeah, absolutely. I mean, especially in Saudi Arabia, because a lot of the teams were mainly women. You know, and you know, as a country, they're very conservative, and women are starting to get more opportunities for themselves, and there's a big need for mentorship. There's a big need for this type of environment to build creativity and to build solutions. And I was blown away. I was blown by the talent. I was blown away by the use of AI in some of the pitches that they had, and I mean, some of them were commercially viable, obviously, and so hopefully they'll come to market over a period of time.
And I think what I enjoyed about meeting the students that Sharonda talked about is that they were really hands-on. Like, if you think in the UK, one of our biggest issues is around spend in falls. Now, that might not seem like a very sexy issue to talk about, but firstly, fundamentally, it affects a huge number of older people. And then actually the amount of cost attached to that, because once people fall and then they're in hospital, getting them out of hospital actually is the bit that takes a really long time, and actually often results in them having a secondary fall or a third fall. So actually finding ways, for me, that's what we also need, the technology. Whilst I know that you've talked, Christopher, and we talked about how you can use the blockchain, it's every single part of it, isn't it? And that's what I think we should always be thinking, big scale, like you've talked about there, but for every single person on that smaller scale, how this can really change their life. So I am going to jump us onto the blockchain, and time goes so quickly, guys, us talking. But blockchain, I do just want to really hear from yourself, Christopher, about, because of your experience in that. Can you just give us some kind of high-level thoughts about how you think the blockchain could be applied in the health system, whether in the UK or across the globe, to enhance the system for both workforce and the patients?
Can I share my screen? Is that possible?
Of course you can. Yeah.
Okay. That's one. I found a slide. I wanted to share.
Let's see if we can get this to work. This is
it's the first time I'm doing this on this platform, so please bear with me. Okay. Oh,
he's a tech guy, so I'm hoping he's going to get it to work, and he did. Very good.
Can you see that? Oh, fantastic. Okay.
Yeah, it's there. Great. Brilliant. Thank you.
So this is just a slide from my presentation of blockchain in healthcare, but this is where I see things going. It's going to be more of a patient-driven landscape, and that's what Web3 is. It's all about taking ownership of your assets, and as a family, as a patient, your medical records is an asset. Your throughout your whole lifetime, many organizations have taken advantage of using that as research and monetizing data from a centralized form. Now, as a patient, you can control it by having your own keys and deciding who you want to share your data to and what level of information you want to share. And these represent different organizations, whether it's practitioners, corporations, insurance companies, policy makers, researchers, other types of organizations around healthcare. And this is controlled using smart contracts. So it can be automated, it can be transparent and more secure by you signing off any transactions when it comes to your personal data and being able to access these different types of services in a much seamless and transparent way. So that's where I think it's going to go, using Web3 in healthcare. And we can do a lot. It's a mammoth task to do this because we did go through COVID, and it did accelerate a lot of patients getting appointments, whether it's remote or accessing the records using the app. But we can do so much more, and we have to be aware that one of the biggest challenges is policy and regulation around your personal data and how it's accessed, and at the same time how it's monetized in a way that makes it beneficial for the patient rather than more beneficial for the organizations that centralize our data.
Oh wow.
Does that make sense?
No. And it's so amazing. But I think one of the things, though, is what some people might find difficult with that is that because if they haven't shifted to that idea of the digital identity to then understand how do all these bits. And I think, it's a really great visual aid, Christopher, as to how you can say, actually, as a person, you own your data. And therefore, if you absolutely own it, then you can sign off in all of these different ways that you talked about it. Yeah. I talked about it in an article recently about how actually if my daughter were to have a health record in her own digital wallet or on the blockchain, accessible via her wallet, she often loses her inhaler and we often have to go and get her a new one. But if she was abroad, she could just go straight into a pharmacy, give them access to see that she is entitled and does need an inhaler, and she would be able to get the medicine she needed rather than have to go and have an appointment with a doctor, use up a doctor's space which doesn't need it and actually cost something rather than just go straight and get it.
Yes, so absolutely.
I think it's such empowering in terms of use of it. But I am so conscious we are like already 38 minutes in. It's just, I had this huge aspiration of all these subjects we're going to cover. So from that then, I am going to jump then firstly, because I do feel we should not talk about health without touching on AI. And that doesn't mean AI is one of the tools that is coming out in this Web3 collection of tools. Yeah. So I wanted to just ask you both for your thoughts on where do you think, is there certain places AI can help more within the health sector? And again, based on the patient or on the professional. Any thoughts on that? Sharonda, your hackathon came up with the AI or the dictionary. And I know that I recently saw an AI system called I think it's Hippo something. I'll put the link in. Hippocratical, which is made by doctors for doctors about identifying diagnosis. Yeah. So, but yeah, what are both of your thoughts on AI in the whole world of health?
When it comes to AI, the first thing I think about is preventative care. A lot of AI can help predict markers for certain conditions, heart attacks. For a short time, I was a chest pain coordinator, and there are certain indicators in your health, whether it be your BMI or your last blood pressure, your hemoglobin A1C, that are indicators of your potential for developing heart failure. These are the type of systems that could be integrated into apps on our phones that say, hey, you're at an increased risk of heart failure now because your BMI increased. So I really feel like in the realm of preventative care, healthcare, AI has a real role in not only helping the providers, but helping the patients take more charge of their own care. That's one of the big use cases for AI that I see in healthcare, more from a patient care perspective than a provider. But on the provider end, also, like I spend sometimes 2 hours after my shift documenting all the things that happened that I didn't have time to stop and document. AI could come in and say, these are the things that I did today, and create documentation for me for all those different things without me having to sit there. It would also make documentation more uniform, so that all nurses are documenting the same things about the same incidences. So those are just a few use cases for AI for me. But I do have to say that when it comes to HIPAA and patient identity and records, those are the things that we would have to overcome before giving AI access to all this patient information.
Yeah, definitely. Christopher.
Yeah, I mean, I second that for Sharonda. I mean, from my experience when I was at hackathons, there was so much AI innovation when it comes to helping patients understand what is prescribed on certain medications, because they don't understand, some of this medication that they get subscribed to, or go to a pharmacy and just to understand, because some of it's in English and it's not translated to Arabic at the time. So the winning innovation, I think, used WhatsApp and a bot to translate a lot of exactly what's in these medications, so people understand, so that they don't take too much or miss overdose or anything else. And another thing with AI that I saw that was really fantastic is being able to really when you go through a screening, there was technology where, based on your, whether it's an ECG scan or anything particular.
I lost my sound.
Oh, can you hear me?
Oh no, I've lost my sound.
We can hear you.
I can't hear anything.
Oh, okay.
You guys carry on talking.
Okay. so I saw one group that had a really appealing
He's back.
appealing solution to me, when I realized that AI could pre-diagnose conditions based on certain parameters that Sharonda mentioned, that can really flag up and be more preventative for that particular patient. Those type of things are very important, because it cuts down the possibility of hospital time. It cuts down maybe preventative or intervention when it comes down to lifestyle changes that are needed. All those things are very, very important as well, and it can be shared on the blockchain, depending exactly how you share it.
And I think, these are the conversations that are needing to be had everywhere, isn't it? Like it's like the value of the hackathon, the value of getting people who are professionals working in the field come in to say, right, this is the new technology, let us show you it, play with it, and now think of all the different ways that this could help you to do your job differently and better. And I think that's what we need to constantly be having the debates and discussions about.
One thing I want to point, I don't know, Sean, I want to jump in there, sorry to cut you, but it's good to have conversation. And a lot of the conversations are done by the big consultancies like Accenture, Deloitte, EY now, I imagine, and some of these other known big tech consultancies. But I'm seeing more individuals like Sharonda who have domain experience, known domain experience, and they tend to come up with better solutions than you have with individuals who want to sell consultancy based on the fact that they may have people that know anything about Web3 and blockchain. I would rather see individuals talking about what they are doing rather than not what they're talking about. It's all about the doing. Are you creating and building, or are you just talking about creating and building? What are you actually doing? And that's why Sharonda's got a lot more leverage than a lot of people, because she's doing the do based on the fact that she has domain experience, plus she's implementing the Web3 technology to improve the conditions for a lot of people. And that's what we need to do more.
So
Thank you for that, Chris. I really appreciate it. Sorry to cut your name short,
Yeah.
Christopher. The reason why I feel so passionate about it is because I feel like in my own career, anything tech wise that has been introduced to me, it came simply from the CEOs, from the developers,
Mm.
from the engineers, and oftentimes it didn't fit into the day to day of a nurse, or it didn't fit into what the patients actually needed. So a lot of my passion comes from knowing that if this digital identity is supposed to duplicate or mirror our own real life, how can they without a nurse? You know, how can you represent healthcare in any form without a nurse? There's no way healthcare occurs without nurses. There's doctors, there's techs, there's everybody, but there's always a nurse at the center of healthcare. So when it comes to healthcare, my mission in life is to empower nurses to be a part of the conversations that will guide how we provide healthcare in the future. So I really appreciate you just recognizing that. That means so much to me. Thank you.
You're welcome. You're welcome.
And I think it also means we need to have another conversation, because we didn't touch on half of what we thought, or what I had an aspiration that we would get through. I think I forgot how quickly, like 45 minutes will go. So we are going to have to kind of draw it to a close. But before we do that, two things. Firstly, I said to people, I asked a couple of questions. So the first one was, what does 8.3 trillion represent? We had our poll. So any thoughts from those of you in the room? 8.3 trillion? Yep. Okay.
Do we say anything?
No, that's it. What do you think? Yeah, like we all knew. So anybody want to say? Okay.
Shall I say?
Yeah, go for it.
Yeah. I think that's what you spend on it within healthcare around the world.
Perfect. It is in US dollars. It is what's spent globally on health services. So, and then the next question was, how many healthcare professionals are there across the globe? So there were 3 different figures here. So which one was the correct figure? What do you think? So what did we have?
I chose 65.5.
Yes. Got another gold star for Shonda. It was 65.1. So there were 3 figures. 83.1, 83 trillion is the amount spent. 10% was to say that it's 10% of global GDP is spent on healthcare, and the number of healthcare professions across the globe is 65.1 million. Or that's at the minimum, really. So, but yes, so thank you. So before we go, healthcare is about our own individual health, but also our societal health as well. Good health means that if we are having good health as individuals, we are much more likely to have a good health as a community, and then as a global nation, if I can put it that way. And we know that the UN has a sustainable development goal very much focused on making sure that everybody has a good, healthy lifestyle. So I'm just going to give you both 1 minute each. You are now the head of the World Health Organization. You can impose anything you want on the whole of the healthcare sector. What might that be? So with that, over to Christopher first, then Sharonda, then myself. So what would you impose?
If I was the head.
Yeah, you're in charge of you're the World Health Organization, and you can do what you want.
The way I would approach this is that I'll look at the biggest problem with the biggest impact if it was solved. That's what I would look at first. If I had the opportunity, I would really set an international standard in enabling healthcare for all, using technology as a main driver. Okay, because with Web3 and with the technology is there, but what it lacks is the simple application, understanding of what it can do and the impact it can have. No country or no citizen of the planet should be denied a standard of healthcare that's humanly possible, and so many people are dying unnecessarily, being misdiagnosed and not being able to access a lot of the basic amenities of healthcare. That it would be my remit and how I'll go about using technology to solve that problem.
You get the job.
Am I?
Well, we at the moment we haven't heard Sharonda's. Yeah, I didn't say it was a job interview, but hey,
no, mine is actually very similar to Christopher's. Like I said, when I stood there in my garage, the first image that came to me was World Healthcare via the blockchain. And I believe in a very transparent and secure way of providing health through the blockchain, almost a peer-to-peer, where patients could be at home, or even if there were health facilities that provided all of the utensils, and all you did was go in an app and vet the credentials of the healthcare professional. And if you and this professional were on the same blockchain, you could exchange tokens for your healthcare instead of there being intermediaries like hospitals and health insurance companies. This way, just like rappers and artists and everyone is finding a way to be paid directly for their services via the blockchain, healthcare providers could have that same opportunity, and patients could choose who they wanted to provide healthcare to them. So that's one. It's in very keeping in with Christopher said. It's an ability for everyone to receive adequate health care, no matter where they are in the world. So that's something I'm very passionate about. I really believe the blockchain has a solution for world health care. And I feel like as long as we keep chipping away at this mountain, we're going to get there, as long as we do it together.
Absolutely.
Yeah. You both get the job. And I think one of the things that I'm going to do is I definitely want us to come back and have another conversation and really dissect that whole concept of what you've just said, Sharonda, around using the blockchain for peer-to-peer transactions, patient to professionals. And I really would love us to have like that half-hour session where we really do. What does it mean? How would you build it? How would it benefit people? Because I think it's an amazing, like the concept and it's a reality, and how can we help people think of that as a reality? So definitely, I really would like you to come back. I hope you'll both come back and talk to me again, and we can have that conversation. If I was the head, I would say that everybody had to give every patient from birth their health record on the blockchain, so that therefore that point forward, I have my health and I can move where I need to around the world, around the country, and I can walk in and get the service I need at that point. And I only have to show you the relevant part you need without exposing my whole health record. But there we go. So, I've got somebody's given me a poll to do again. Yeah. Okay. So I'll do that again. So somebody got happy with our poll. So we did have some questions and we haven't got to answer them, but don't worry. We will definitely post some answers on that on our LinkedIn and our Twitter and on our YouTube. Yep. So we'll make sure we answer those. What I'm going to do is I am going to give you, massively thank you for coming. Thank you for sharing your time with us on this. It is a Friday in the afternoon in the UK. So Christopher and I are on the same time zones. Sharonda is in the States, so it's the morning for her. But it's been a great conversation. I've really, really enjoyed being together with you both and having this conversation. So thank you.
I really did. Thank you. And I know we can stay in touch, Christopher. I really love your mom's story. It resonates so much with me. Thank you so much for having me, Alison. I'm so grateful.
Cool. Yeah, definitely. We can do that on LinkedIn and have a conversation afterwards. But I appreciate your invite, Alison. And I really, really do.
Cool. We will do that again, and we'll definitely do it again. If you want to get a hold of Christopher or Sharonda, if you just go on the hub under the session, you'll see their names and their Twitter, but also it is now pinned in the chat. So on that note, I am going to draw the session to a close, say thank you once more. Thank you to those who have turned up to listen to us, and look out for our future sessions on health. Take care, everyone.
See you all next time.
See you guys.